A lot of us women always hold our urine either because we're just busy with the kids, or sometimes you just have to because of your job. In the OR, a lot of times I hold my urine, but if you're just doing it to be polite and ladylike and you can go, you should go. Because if you're holding your urine and all that urine builds up in the bladder, then what happens is it just sits there, and if it's just gonna sit there, it acts as a medium for bacteria. So more and more, so the longer you hold it, the more and more bacteria are gonna multiply in there, and the more bladder infections you're gonna get, the more it may lead to other kinds of conditions like interstitial cystitis, the more you may have problems with leakage of urine because your bladder starts to get stretched out, and so we call it overflow incontinence, and that's really just because you're holding it and letting it build up, and you're really putting a lot of pressure on those bladders.
So to put this in perspective, what Dr. Lisa is saying is that normally this is the normal size of a bladder, but the size of a pear, but it can distend to the size of a grapefruit. I mean, that's a big difference.
You know, I see this in kids a lot, younger kids, when they just don't want to go, so they sit and hold it all the time. And then their bladder gets stretched out, and then their body kind of loses the ability to learn the signal that they're full, and that's why they have so many accidents.
Let out the gas.
Yep.
Let out the urine.